Another study that was recently done and released in the Journal of the American Medical Association in JAMA Pediatrics, and it talked about individuals who underwent top surgeries. The findings of those groups, there were two groups that were measured. The findings showed that after 3 months, the group that had what is commonly referred to as top surgery experienced less chest dysphoria compared to the group that did not have surgery. The summary said that top surgery is associated with improved chest dysphoria, gender congruence, and body image satisfaction in this age group. Fox News picked this story up and basically said, nuh-uh. And literally that was the argument. Some have taken issue with the findings, saying that a sample study of only 3 months is not enough time to determine if these young patients experience less dysphoria after surgery. Stella O'Malley, as a psychotherapist, said, I don't think the study should shape clinical care because 3 months after an operation, people can easily feel happy because complications haven't happened yet. What we need to know is how do they feel after a year, and how do they feel after 5 years? How do they feel after 10 years? Then you've got something statistically significant, and you've got some serious data that you can actually shape your clinical care around. Right, yeah. They don't have contrary studies. What they have is observational disagreement. We've already seen some studies that have looked into the positive impact of gender-affirming care. We've seen how the studies shape up with puberty blockers leading into hormone replacement therapy at a 98% carryover, meaning that 98% of people in this study, there were 720 people in that study who started puberty blockers in youth and then transitioned to hormone replacement therapy as they got older. 720 of those, 98% of them continued on. Only 2% stopped gender-affirming treatments. We've seen the numbers from studies that have been done in the past that says that overall, the number of people dissatisfied with that transition, dissatisfied with the work that is done, is in the number of 2 to 8% who are dissatisfied. And yet those numbers are not good enough. Those numbers do not support in any way someone having top surgery. We can't connect the dots to say, okay, someone can have one form of gender-affirming care, but that does not reflect in another form of gender-affirming care. 2 to 8% are dissatisfied with transition. So maybe we should start listening to them, huh?